As an employee for 12 years, I am thrilled to see how far our company has come in promoting health and wellness. Quintiles is definitely a gold standard employer, with all they are doing to encourage us to reduce the risk of cancer and other diseases by promoting a healthy lifestyle.
After being diagnosed with cancer, I was able to go for treatments without worrying about time away from work. I am very thankful for GSK's mobile mammography service because I wouldn't have had a mammogram were it not for the convenience of the service.
I have received outstanding support from the SAS Healthcare Center in all aspects. The benefit plans have granted me access to the best medical team at one of the best hospitals in the world, at Duke. SAS made it possible for me to continue the fight for life and to continue meaningful relationships at work. When your employer, colleagues, friends, and family refuse to give up on you, then and only then can you find the will not to give up on yourself.
I'm Bill Weldon, Chairman and CEO of Johnson & Johnson. I'm also privileged to lead the CEO Roundtable on Cancer, a nonprofit organization founded in 2001 to help in this fight against this deadly disease. Our first initiative is the CEO Cancer Gold Standard, a program that is not only the right thing to do for your employees, it's the right thing to do for your business. Research tells us that at least half of all cancer deaths are preventable. As a business leader, you need to know that the Gold Standard can not only help you stem rising healthcare costs, but can also make a tremendous difference in the lives of your employees and their families. This is a serious problem, but working together, it's one that we can do something about.
The battle against cancer must be fought on many fronts. The CEO Roundtable on Cancer was founded when former President George Bush, the 41st President of the United States, asked a group of CEOs to be bold and venturesome in the fight against cancer. Led by a growing list of corporate executives representing a wide range of diverse industries, the executives share a common vision: the elimination of cancer. The CEO Cancer Gold Standard is a program based on solid scientific research, which can help your organization reduce the burden of cancer.
Across our country, cancer takes a tremendous toll on people's lives. But we're making great progress through programs that help lower the risk of cancer, detect it earlier, and provide access to the best available treatment. I'm John Sefrin, Chief Executive Officer of the American Cancer Society. You know, today we understand that most cancers are linked to a few very controllable factors. For example, things like tobacco use, poor diet, and lack of physical exercise. Tobacco use alone is the #1 cause of cancer and the #1 cause of preventable death throughout the world. In fact, we now know that more than half, I repeat, more than half of cancer deaths can be prevented during a normal human lifespan. Think about that. It's a remarkable statistic. With the certainty of knowing that many cancer deaths are preventable and knowing that early detection leads to better outcomes for the patient, the Gold Standard gives us a remarkable opportunity to change the mortality curve. The American Cancer Society is very pleased to encourage employers of all sizes, large and small, to adopt the Gold Standard.
Companies of all size and representing a wide range of industries are taking concrete actions in the area of health and wellness to fight cancer in the workplace.
When I first learned about the Gold Standard, it appealed to me because, like every employer, we're affected by cancer. It's a disease that doesn't know any boundaries, and our employees are at risk. In the United States, this risk is really very high. Almost 50% of men and 33% of all women will develop some form of cancer during their lifetimes, and that's a sobering fact. I'm Greg Galopoulos, the managing partner at the law firm of Jenner & Block. We've embraced the Gold Standard as providing our firm with a comprehensive approach, addressing cancer really from every angle: prevention, early diagnosis, and quality care. And we're really especially proud here at Jenner to be the first law firm in the country to receive Gold Standard accreditation. I strongly encourage others to participate in this program. We believe the Gold Standard gives our organization a real shot at controlling the high costs associated with cancer. And that's really important. But what's even more important to us, the Gold Standard gives us a real shot at reducing the impact of cancer in the lives of our people. By focusing on our people's health and giving them the tools they need to lead healthier lives. There are approximately 1,200 of us here at Jenner & Block, and even beyond the benefits we expected from the Gold Standard, we've been pleasantly surprised, and very pleasantly surprised, at how the Gold Standard has helped us to come together as an organization. We're eating healthier, we're walking more, we're quitting smoking, and we're becoming more aware of health issues through brown bags and health fairs. Our people have bonded together more to meet these challenges. I encourage you to adopt this program. It's definitely a win-win for both your organization and your people.
The Gold Standard has 5 areas of focus, or pillars as they're called, that fall within 3 broad goals. The first 3 pillars, tobacco use, diet and nutrition, and physical activity, support the goal of risk reduction through lifestyle change. We know that by eliminating tobacco, exercising regularly, and maintaining a healthy diet, we can reduce the risk of cancer significantly. The 4th pillar, prevention, screening, and early detection, is critical because we know that screening can find certain cancers early on when treatment is far more likely to be successful. Benefit program coverage for screenings such as mammograms and PSA tests is critical to reducing the incidence of cancer in the workplace. And finally, when someone is diagnosed with cancer, quality care is essential. Information about the latest advances in the field of cancer research, along with reducing barriers to clinical trials, enable employees and their families to take the concrete steps necessary to secure the best available treatment. That's where the 5th pillar, access to quality treatment and clinical trials, comes in. The Gold Standard is not only the right thing to do, it makes good economic sense. A study by Milliman, an actuarial firm, found that cancer prevention and early detection are relatively low cost, while not surprisingly, the cost associated with cancer is quite high.
Last year, I was at a workshop where a breast cancer survivor encouraged 300 women to get their mammograms. She said that 1 of every 7 women will be diagnosed with breast cancer in their lifetimes. We were seated at tables of 8, and I remembered thinking, wow, that's 1 woman at every table. I had my mammogram the next week and soon learned that I had early-stage breast cancer. As you can imagine, my life turned upside down overnight. What didn't change, though, was GlaxoSmithKline, my employer. They were behind me 100%. They gave me the time I needed to recover from surgery, to get my radiation every day for 6 weeks, and they encouraged me to investigate yoga and other relaxation courses. Thanks to their support, I was able to see cancer as a turning point, and I changed my life. I now work a flexible schedule so I can spend more time with my 5 children and do more of the things that bring me joy. Being diagnosed with cancer is hard, but having GSK be so supportive meant the world to me. They were a big constant in a world that was changing every day.
That's what the Gold Standard is all about: helping your own employees, helping their families, making a real difference in the fight against cancer in a way that is good for your business. The Gold Standard is something very specific that we can do today to reduce the burden of this disease. I'm asking you to give serious consideration to adopting the Gold Standard within your company. You're probably spending most of your healthcare dollars on the treatment of preventable conditions. Think about that. The Gold Standard gives you an opportunity to save lives and save money. Your employees are your organization's greatest asset. Doing what it takes to protect their health can help you better manage your overall healthcare costs. I urge you to review the information provided by the CEO Roundtable on cancer and to visit our website for more information. If we're going to make significant progress toward reducing cancer, then public institutions, community-based organizations, and private industry all must work together to accomplish three things: reduce the risk of cancer, take advantage of screening tools to find cancers early when treatment is more likely to be successful, and make state-of-the-art science cancer care a reality for all.